We often treat modern medicine as a precision tool. You take a pill to address one specific symptom, and it dissolves to target that single issue, while the rest of your body remains unaffected. But the human body is a web of interconnected systems. Introducing a chemical to fix one problem inevitably triggers reactions elsewhere, and for many patients, the most disruptive casualty of this crosstalk is their sexual health. When these changes occur, the standard reaction is to view them as a medical failure. Rather than discussing the issue, many patients decide the trade-off is too high and quietly stop taking life-saving prescriptions. Within urology, however, these biological disruptions are viewed through a different lens. Specialists don't always see these glitches as hazards. They see them as clinical opportunities. By looking at the full spectrum of these effects, from severe neurological shifts to simple physical roadblocks, we can see how doctors have learned to harness these reactions, using the very bugs of one treatment to solve the sexual dysfunctions of another. At the high-stakes end of the spectrum are dopamine agonists. These are essential for managing the tremors of Parkinson's or restless leg syndrome, helping the patient's body become steady and still. But because these drugs alter the brain's reward system, the trade-off can be severe. Stripping away physical tremors can also strip away inhibitions, leading to sudden hypersexuality or pathological gambling. A different kind of systemic shift occurs with finasteride. It blocks the conversion of testosterone to shrink an enlarged prostate, solving a painful physical obstruction. Because it also affects hair follicles, the drug has found a massive cosmetic application for younger men looking to reverse balding. Yet, for some, the cost of a fuller head of hair is post-finasteride syndrome, a crash in libido and erectile function that can persist long after the patient stops taking the medication. These cases show the risk of prioritizing cosmetic results or physical relief over long-term hormonal and psychological stability in a body where every system is linked. Further down the spectrum are mechanical side effects. Beta blockers are a prime example, prescribed to lower dangerous blood pressure and protect the heart. The drugs manage these high numbers to prevent cardiovascular failure, but the way they work creates a physical conflict elsewhere. The medication blocks beta receptors to slow the heart, but accidentally blocks identical receptors in the penis. Tamsulosin creates a similar mechanical issue. It relaxes prostate tissue for urinary flow, but like a gate closing, blocks seminal fluid. These trade-offs are often negotiable. Because they are physical rather than neurological, switching to a more targeted drug or adjusting the dosage can usually restore function without compromising the patient's primary treatment. The most interesting part of the spectrum is the therapeutic flip. This happens when a side effect is so predictable that doctors prescribe the drug specifically to trigger that glitch. SSRIs, or antidepressants, are famous for a side effect that many patients find debilitating: the inability to reach orgasm. Urologists took this delay and weaponized it. By using low-dose SSRIs off-label, they turned a frustrating side effect into an effective treatment for lifelong premature ejaculation. But the ultimate example of a weaponized side effect is the category of PDE5 inhibitors. This pill was never supposed to be a household name for sexual health. It began as a cardiovascular drug designed to treat the heart. When it failed its original purpose, researchers noticed its profound effect on erections. This failure became the foundation for the entire modern erectile dysfunction industry. The world's most famous sexual enhancement drug is, in reality, a failed heart medication. It shows that in clinical medicine, a biological bug can be transformed into a valuable feature. Prescribing medicine is a game of biological chess. To move one piece, you have to be willing to leave another exposed. These sexual side effects are the direct evidence of how the brain, heart, and hormones operate as a single connected circuit. If a new medication changes your sex life, suffering in silence or stopping the treatment without a plan is rarely the best path forward. Sharing these unintended changes with your doctor provides the specific data they need to adjust your dosage or pivot to a more compatible treatment.